In 2016, Ontario Shores first implemented Health Quality Ontario's Quality Standard for Schizophrenia. The Quality Standard for Schizophrenia care in hospitals and in the community helps patients and families know what to expect around medications and psychotherapies, including family intervention therapy. We sat down with Kevin and Jane, who have participated in family intervention therapy with their son Riley, a current inpatient at Ontario Shores, to learn more about their experience.
So my name is Daryl Mathers. I'm the communications officer here at Ontario Shores, and I'm with one of our families that we work with quite often these days. I'm with Jane and Kevin. So first of all, thanks for sharing your story. Appreciate that, for being here.
You're welcome. Yeah, it's good to be here.
And could you just tell us a little bit about your connection to Ontario Shores and maybe specifically to schizophrenia?
Well, we have a long road that we've been down. It started back in around 2010. Jane was in a catastrophic car accident and she was left disabled. And it had a very negative impact on our family. And both our daughter, Tori, and our son, Riley, were badly affected psychologically. And they both came down with schizophrenia and started to show some very significant symptoms of it. And it progressed with them. Started off with fairly minor symptoms, but progressed to the point where they became psychotic and required hospitalization.
So schizophrenia, obviously, it's very complex, severe mental illness. And you were talking earlier, and you don't necessarily have a lot of experience in dealing with it as a family. So it must have been a really challenging period of time in your lives.
I don't remember much about it in the beginning because I had a brain injury, but so Kevin had to deal with the brunt of it. But it certainly is complex, and even between our two kids, there's been different solutions and different things that have helped and hindered, and it changes daily. And you think you're just on the road to success, and it'll kick back a little bit. So it is very complex and multifaceted, and
it impacts the entire family. So while your children are going through this, it's you all are going through this at the same time, are you not?
Yeah, it's a family problem. It's not something that's just a problem that the children have, but it's also one that's affected Jane and myself. We have two other children. It's affected their relationships with their siblings, and they have children, so the nieces and nephews, it's affected their, and along with our extended family, it's affected all of my brothers, sister-in-laws, nieces, nephews as well. So it's had a big effect on all of us.
So one of the reasons that we're here today is to talk about some of the therapies or some of the things that have worked well during your son's time here at Ontario Shores and your experiences with your daughter as well. Can you tell me a bit about family intervention therapy and how you how you first maybe became involved with that?
Well, this has been Riley's second time to Ontario Shores. And Victoria, our daughter, she's been here before as well. And this is the first time we've been introduced to the FIT program. And Heather Boudreau, who's been helping us with our family interactions, has been very helpful. One of the things that happens with schizophrenia is that the patient is quite ill. And many times it can be very hurtful, not intentionally, but it's a symptom of the disease. And one of the hard things to do is then to recover from that and the injuries that causes to interpersonal relationships. And then Heather's given us tools that we can use to help mend our fences and start over again and build our family back together.
What maybe are some examples of what those tools are like? What did you find particularly useful as you're going through the family intervention therapy?
well, we have sheets that we can hang on the fridge and use the catchphrases and things about questioning without conditions. Kevin's always saying now, what is it you say?
A positive request. And I'd like to clarify that. Mm-hmm. So these are very simple tools, but they're very effective tools. And it's a great way to start a conversation about some difficult issues. If perhaps you want to make a positive request about somebody, and it may be very uncomfortable, but you can make it in an objective way, and then you can express how it makes you feel. And then they get to respond to you and express how they feel about it. And then you can discuss that. And it opens the door, gives you a platform to work from.
So there was a lot of practice in class, and sometimes it was slower going than others, and sometimes Heather would want to move on to the next topic, but we needed to go back and work on the things that we'd done but hadn't quite perfected. And some days are more stressful in people's lives than others, and it's just how to have healthy interaction with each other instead of, as my children would say, nagging.
I would imagine patience would have been a real asset when you're going through family intervention therapy on both sides. Would that be accurate, or?
I think for sure that patience is a big part of it. It's a long road, and it's not when you sprint down, it's when it's a marathon. So you have to be careful to move slowly. And it's like a bunch of turtles. Everything moves very, very slowly in mental health. Progress for the patient is slow. The adaptations for the family are slow. So patience is a big part of it.
How did it impact your relationship once you kind of got into the middle of the program or towards the end or wherever stage? Like, when did you start seeing a difference kind of in your relationships?
When there's a breakdown in the family, you can play the blame game. Oh, you caused this, or you did this, or this is your fault. Or you feel, in my case, I feel a lot of guilt for what the children struggle with because I was in this accident and it seemed to cause a real breakdown in the kids, and they got into some things that they shouldn't have. And so because I wasn't totally aware of everything in the beginning, it fell on Kevin. But now we're working together and we have a common goal and we have the common skills, and you can talk out things without blaming or without negative feelings. And it's a really, really nice way to communicate with our son, because when we say, I have a positive request, his ears perk up and he knows that, okay, this is not done out of negative feelings. This is done out of positive caring, and that's a really good place to be able to go to just by that little phrase. And then some days are better than others, and we all struggle, every one of us, but it's been a very, very good experience for Riley because he sees us all working together, and that's really important. And our daughter, who now lives in Kingston, we don't have that therapy at all, and so it's you try to use the same techniques, but you don't have the facilitation of it. And the facilitation is huge, because we could have been given the pieces of paper and say, here, ask questions in this way, but it wouldn't have had the same impact.
So you really need that kind of collaborative approach to it, not just like, here's some homework, go home and study. That's not going to cut it by the sounds of it.
It would be similar to me giving you a stretching program, and you have a piece of paper and saying, I want you to do the stretching. And you can read the words and you can see the picture, but actually getting down on the ground with you and saying, okay, and this is how it should feel, and this is exactly how long you should do it for. And the process is so much better when you have a facilitator.
When you think back to maybe a few years ago or a few months ago, whatever that point was where things were like fairly bleak, or maybe there was, the status of your relationship wasn't quite where you wanted it to be, how you felt then to how you feel today, when you think about that relationship, how far has the needle moved in that period of time?
I would say the needle's still moving for us. Riley is still struggling. He's on a new medication. But the big benefit of the family intervention therapy is that Riley's been able to see that he wasn't moving ahead with his previous medication. He was stagnant and that things were not improving. He was able to understand that he had to make some changes. And the one thing about the mental health that he's suffering, he has to choose to take the medication. It can't be forced on him. It's an oral medication. So he had to agree. And there was a lot of process to get there. So he's now, but I think it's about 12 days on the new medication, and we're just now starting to see some benefits. So the needle is moving slowly.
But as far as the facilitation of the program, it is going to constantly be there because they're tools that we can use forever. But being able to get together every week with a neutral party, Heather's like Switzerland, and we come in with different politics and different stressors, and that facilitation is a huge part of this process.
If you were to meet another family that was going through a similar situation and were considering family intervention therapy, what would you say to them?
Don't give up that opportunity. Because we have 2 children with schizophrenia, we have the opportunity to objectively look at how our relationships are with Tori and how they're growing with Riley. And we are struggling much more with Tori and our relationships with her because she's not part of the family intervention therapy program. She hasn't learned the skills. She doesn't know what we're trying to do or how we're trying to do it. We're trying to be facilitators and use the program with her, and it's not working as well as it does with Riley. So I would tell any family that has the opportunity to definitely take advantage of it.
Is there anything else about the family intervention therapy program or your experience that comes to mind when I might ask you to share anything additional?
This may seem like something that isn't connected at all, but we are allowed to bring our dog in every week for the therapy. And when Riley's really stressed, he has the dog to interact with too. And that's a huge thing. It's like, pet therapy, but it's part of this whole process. And anything that helps diffuse a situation or helps tone it down so people don't become emotional and lose the benefit of positive interaction is really a great thing. And it was really nice that we could involve the dog. That sounds really...
No, it's part of having an open environment or an accepting environment and trying to make it as comfortable as possible. I think we've had a few patients that have had similar experiences, whether it be a dog or having somebody else attend a meeting or whatever the case may be, but whatever you can do to make them more comfortable. I was going to ask just a couple more things about the family intervention therapy program. What would you... at what point should we be making this available to families? Like, were you ready to do this earlier in your journey? Is this something you would have liked to have sooner rather than later?
I think prevention's worth a lot, and I think we would have been able to have avoided some of the crises that we've been through had we had better tools to use. I know I would have acted very differently if I'd had the background earlier.
Last year, Riley was here, and he was allowed to go to recovery college for 3 months, but we didn't have any skills to use at home. So he would come home from recovery college, and he'd spend a really positive day doing music therapy and art therapy and things, but we didn't have tools or tools to identify any stressors or things like that, and it just went back to the same behavior when recovery college ended. And hopefully these tools will continue because I've got my piece of paper. So
opening up and sharing your family's story is not easy to talk about for most people. Why, when you were asked to do this, did you ultimately agree to talk about him?
One of the things about mental health is there's a stigma attached to it, and a lot of families have mental health issues, and they don't want to talk about it. And I think it's important to realize that you're not alone. And if Jane and I share our experiences with others, perhaps it'll make them feel just more comfortable to reach out and ask for some of the help they need.
I think it's also a great way of telling Riley that we're there for him, and it doesn't matter what we have to do to make it better for him. We're willing to do it, because he's a great guy, just a great guy. He just has struggles in different ways, and if going public with the story is going to help him or to help anyone. And I was a Lamaze instructor and used to teach people how to have great experiences with their babies. So this is just an extension. It's moving along in life's window, and it's just a different place. I don't have to talk about babies anymore. I'm talking about something else. But it's so important for our family to get through this. We want to come out intact and healthy, and let Riley know that we're there for him, and we want him to keep up with all the positive work he's been doing.
When we talk about mental health and the stigma, or even education, schizophrenia, there's a lack of stories about patient stories, family stories, and even treatment. And you sharing your experiences is really helping close that gap. So thank you very much for bearing your soul and sharing your experiences with us. We appreciate it.
You're very welcome, Darryl.